and not just sort of names on a screen. So fantastic to be here. We've got sort of about an hour or so before lunch to talk about immersive technology, and I'll let my colleagues introduce themselves as they come up. So my name's Delith James. I think we've heard the digital health ecosystem mentioned this morning. I might rename it now to the Digital Health Jacuzzi Wales, because my role really is about finding out about innovation and those bubbles underneath the water. So I'm going to briefly explain what we do at the Life Science Hub as well. But my role is very much about bringing people and systems together. And I really hate that you've just all been networking, doing all the things that we encourage you to do. And I've asked you to stop doing that and come and listen to me. So I hope that you do carry on with the networking a bit later. But I hope you've heard of the Life Science Hub Wales. It has been mentioned a few times this morning, so I'm really grateful for the shout-outs. We're an arm's-length body of Welsh Government, and we really exist to bring together innovation and collaboration between industry, health, social care and academia. We've got really simple strategic aims, and that's to improve the health and well-being outcomes for people in Wales and improve efficiency and value within Wales, within the health and social care system, and drive that economic business growth and development through jobs. And we do this really by creating connections. We support industry engagement, and we work with health and social care in Wales to understand their challenges and needs. I think one of my most favourite parts of my role is talking to clinicians and the people on the ground to really understand what the barriers and the problems that they're experiencing in doing their day-to-day work, and looking for those solutions and innovations to help support them. And we invite companies and innovators from across Wales, the UK and globally to work with us in Wales. So how do we do it? Well, we convene, we bring together the health, life sciences ecosystem, and we integrate and we support a coherent, coordinated, collaborative approach across our partners. We want to accelerate access to that transformative innovation, and we advocate as well, influencing at a UK level, showcasing excellence and opportunities. I wanted to talk a little bit about the support. We've heard mentioned this morning already some of the barriers and problems that industry experience when trying to get adoption within NHS and social care in Wales. And I wanted to talk a little bit about the services that the Hub can offer to help support with that. So we've got project management services, and we've got project leads at the Hub who can support industry, health, social care and academia with particular collaborative projects, providing that additional bit of support. We heard about the issues that people might have around that administration, having processes in place, but we can help support people to do that. We've got a sector intelligence team that produce market reports and do rapid scans. So if you've got an idea that you want some support with, you've got an issue that really needs that innovative solution, if you could come to us, we can have a look at what's currently available on the market and provide you with a report that lets you know what's currently available. We've got business case development, again through our sector intel team. So if you've got a pilot or a project that you've been working on and you're looking to have that adopted within your health board, we can provide some support to help develop that business case for you. And also we've got funding support. So we've got information about opportunities around funding collaborations, and we can provide support through our funding specialists to help you. If there's a Wales collaborative bid, they can provide feedback on those applications and give advice and support that way. Partnership development and facilitation, that's my role. I think very much sometimes I'm described as a bit of a matchmaker. I love bringing people together. So I work quite closely with clinicians, find out what their problems are, and then talk to industry, quite often at lots of different events. In the last few weeks, we've taken Widdy's robots to Het and talked about the things that are happening in Wales. And just last week, we took a couple of clinicians with us to the MedTech Global event, which was really exciting because we were able to talk about the things that are happening in Wales and really demonstrate the things that we can do really well. Communication, support and amplification, I'll touch on that just in a second, but we also do signposting. So I think it's very rare where we can go into a meeting and we don't have the opportunity to signpost people on to further support or access to different partners. And then we do have quite a fantastic network. We've got a website which we can monitor the number of clicks onto the website, so we hold a lot of information available to people on there. And we've got things like the case studies of innovation that we've been working with. So, for example, I've seen on one of the slides today about PainCheck, a fantastic pilot that we're working with throughout the hub that uses AI and facial recognition technology. So we've got a case study on the website. We've got lots of press releases about the work that we're doing, so it's well worth a visit. We've also got a database of over 3,000 contacts that we send our newsletter out. So if you've got an event or you want some information disseminated, please do come to us and we can pop that onto our newsletters and circulate that. We've got our social media channels. So I don't know if you follow us on Twitter or LinkedIn, bit of a shameless plug there, but please do follow us and see all the different things that we've got happening there. One of the other things that we do is hold some events, and we have a special interest group at the Hub around AI technology, which is a well-established group, and it's been running for a couple of years. We've got about 130 clinicians and academics that join us at that particular group. We meet on a quarterly basis virtually, and we talk about Wales-specific projects that are using AI. We talk about regulatory issues, the barriers to establishing projects, etc. But also we invite industry along to that and talk about the art of the possible. So that's quite an exciting way of seeing what's available and talking to industry and finding out about their barriers and what their challenges are to adoption. So that was a bit of a whistle-stop tour of the Hub. My sort of call to action from that is really that I'd really encourage you to get in touch. We love talking to people, finding out the things that you're looking for. I've had many a happy marriage through my sort of matching service, and I'd love that to continue. So please do get in touch and let me know how we can help you. But I'm going to hand over to Hugh now, who's going to talk a little bit more about the sort of collaborative work that we've been undertaking at the Hub.
Good morning, everyone, and thank you for inviting me here today. My name is Hugh. I'm an emergency medicine consultant by trade, and I've only just come off nights last night, so I was called out 3 times. I feel like I'm just about caffeinated enough that I should be able to stand up throughout this, but if I do look like I'm lagging a bit, feel free to throw something at me. I also work for Cardiff University, and that's half my other role, where I am a Programme Director in Emergency Medicine degree, as well as the acute end of the undergraduate course. And recently we made the Clinical and Innovation Lead for the medical school at Cardiff. But I'm here today to talk to you about the Immersive Technology Special Interest Group, which I'm the chair of, or the first chair of. The thing that I wanted to kind of first bring up is what is our biggest problem? What is our biggest problem in Wales for innovation in this area, particularly in the world of immersive technology? Keeps on skipping ahead, I'm not sure why, sorry. I think it's because we're still working in silos. I know of clinicians who are working on similar projects in different places, in different health boards, We've got people working actually within the same department sometimes that are actually working on very similar projects and don't find out till about 6 months down the line that we've been working in the same area. Even within the HEIs as well, not just between the HEIs across Wales, but also within a particular university, actually within the same college of university, sometimes within the same school of a college of a university, we find out that we're both 6 months or a year down the line in a certain area. And one of the things that we're keen to do with this new group is to start to break down those barriers. So I thought I'd start off just with some lessons learned from a particular project which I felt broke down some of those barriers before we go on to evaluation and research. And I'm only going to be touching on that because one of our other speakers is talking about that. Then integration, future projects and how not to work in silos, and then how I feel like our immersive technology special interest group, which has been run by HEIW and the Wales Life Science Hub, can help. So lessons learned. We did a project a little while ago. It started around 2.5 years ago, and it was called the Wales Virtual Hospital. And in that, we basically went cap in hand to the Accelerate programme, and we were asking for some money to develop this project. And within this project, they then put us together with their usual suspects, which were St David's University and ATIC, who did a fantastic amount of work for us on evaluation. We also were put in contact with a certain company and the other HEIs that were involved in healthcare education and all of the different health boards. And we thought, really, we're all after the same thing. We're after a similar product that can help us. That product, we initially had £180,000 from EU funding and then Welsh Government funding. The Wales Virtual Hospital is what we came up with in the end, and this is something which we were trying to cut down on some of the problems that we had with other products we were buying in. So first of all, time to create. We had problems with that in terms of sorry, the slides are skipping ahead faster than I can talk through them, and I'm not controlling them, I don't know why. So problems with the time to create. We've had certain products that we spent maybe 14 months trying to create a certain learning event around, and by which time the guidelines we were trying to teach was already out of date. We've also had some problems in terms of access. So access into the student records or into NHS e-learning for Wales. We want to be able to put that data directly from a product directly into those databases. And also access in terms of what we're using, because of course these fantastic XR products, some very fancy ones that you can put on your head, are not fit for purpose for everyone. And we've got to cater to our students and trainees across the board. And it's great that that product will work for 299 out of the year group, but we also got to cater for that one person who can't use it, who feels unwell with it, etc. We also then got to try and distribute that product across many different disciplines across Wales, and that would mean access via an LTI to be able to sign in with your NHS e-learning, your NHS password, or maybe your Bangor University, your Swansea University, or St David's University email and password. And then we also had some problems with the expense of it. So if I was to describe that a £24,000 project is something that only created 16 minutes of content. That's what we paid before. We wanted to be able to reduce that down so that for the health boards, it was zero cost, other than the clinician's time. And of course, because it was zero cost, procurement are then no longer interested. They will sign things off. It's one of the biggest barriers, I think, for immersive technology to get into the health boards and universities is that final step of getting across the threshold of procurement. So this is what we came up with. Wales Virtual Hospital, free software developed and owned by all the Welsh HEIs and NHS Wales. And I'm not going to go into the product too much because, we were supposed to be having someone to come and talk about it a bit later. But effectively, it's a system where you can create new software. It's a bit like PowerPoint. And then after that, you can deploy that to your learners, and it doesn't matter where they might be. They might be in any part of Wales. It might be that you need to deploy it across multiple devices, but you just do it once. And then you can also analyze what's happening in there as well. So where the students are looking, are they monitor fixated, or are they actually looking at the patient? What their module scores are, what the critical questions are. Perhaps they scored 99% but gave the wrong drug and killed the patient, so obviously they can't pass. But eye tracking software.